it's Dr. Jen from drjenmed.com. Today I'm doing a video in honor of our fathers. Happy Father's Day when it comes in tomorrow, Sunday. And today I would like to talk a little about prostate. I know a lot of men some men don't even want to hear about prostate because all they know about is prostate cancer. And it comes with a lot of stress because maybe they've seen other men suffer, and I just want to do this video in honor of the men, and in particular in honor of my now deceased father, who died from another type of cancer. But I do believe if perhaps daddy was a little more proactive in his health, I believe perhaps he would still be here with us today. So I first of all want to honor him. His name is Morris Baker in this video. Okay. So men, your prostate is a gland that is found below your bladder, right in front of your rectum, right? And its purpose really is to make some of the fluid that's going to make your semen or your cum. So the fluid it makes mixes with the sperm, and that's eventually going to form your semen or your cum, right? It also helps when you are going to ejaculate, so it gives you that force for you to come, and it also plays a role in controlling how urine will flow, because it wraps part of the urine tube, that urethra is wrapped around by the prostate, right? So as you can imagine, it serves a very important role in your masculinity. Now, what tends to happen is that as you get older, you can have issues with your prostate. The most common issue, like a lot of men have as they get older, is that the prostate enlarges, this gland, right? It gets bigger and it can cause some problem. Now, that in and of itself is not cancerous. It's called BPH, benign prostatic hyperplasia. It just causes annoying symptoms. But what all men are scared of is the big C word, the cancer. And they tend to have very similar symptoms, because as you can imagine, once the prostate gets larger, it's going to cause some urinary problem. So you might have a weak flow, the stream not so strong. When you want to start to pee, it's like you have to strain. You can't just stop yourself from urinating. You might find that you're urinating a lot at night, getting up frequently to go urinate. And it might burn, and it can reach a point you might even see blood in the urine, right? Or blood in your cum, in your ejaculate, right? So those are the most common symptoms, those urinary symptoms, right? The stream is just not so good, right? Now, I want to say this, that most men are afraid of hearing about surgery. You know why? Because them tell themselves them prefer dead than them penis can have an erection. Not true. You've heard that. And 99% of the times, men who do not take action and then the cancer get worse, they have so much regret, because at the end of the day, it is your wife, your woman, your children, your family who suffer when they see you get sick and, pop down, knowing that you could have taken action early. Knowing. So I know a lot of the men are, truth be told, it's so God make you the testosterone. You're kind of hard at ears, and you're kind of stubborn and, proud, truth be told. But here it is. As a doctor, I'm telling you, men, get yourself checked. Because if you catch prostate issues early, nowadays and modern times, a whole heap of things can do before you even reach surgery points. Whole heap of things can do. And that brings me to my next point, that you don't want to really wait till you have symptoms. You want to start the certain tests. We refer to that as screening. Screening simply means let's just check for a problem, particularly if you have it run in your family. Not true. If you know you're not live the right lifestyle, you not eat properly, you don't exercise, you drink a lot of alcohol, things that would keep you healthy, you're not doing those things, right? So you would want to do a blood test called a PSA, prostate specific antigen, where they check it gives a measurement of the prostate in terms of if there could be any cancer or even just enlargement. Even infections can cause that to be high. Prostate infections. Your doctor may do an examination called a digital rectal exam, in which one finger is inserted through the anus into the rectum, because as I told you, where the prostate is, the doctor may be able to feel any abnormality like enlargement, nodules, anything. You can, you can literally feel changes. But if you're not going to that the test, because I'm gonna man doctor, go to a female doctor. Or if you're not doing period, get the blood test done. Because once you pick up these things early, as I said, you can intervene. You can intervene. Don't wait, men. Do not wait. Prostate cancer is the number one cancer in Jamaica. It is the number one cancer in Jamaica, and
Huh?
it will also cause
A
a
lot of
lot of
damage?
death and mortality. Hold on a
Caused from.
second. Yeah, hold on a second. I'm on a video. You hear?
Okay.
Yeah. So it will cause a lot of mortality and death, literally.
Yeah,
So
it'll
you,
cause you death.
thank you. So 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 it's very important that you get it tested. Just a blood test, just an examination. The treatment nowadays, sometimes they just watch it, active surveillance. They just watch it and monitor you. Um, the next step they'll do is a biopsy, right? How could I forget? They might do some tests, some scans, just to check, make sure there's no spread, to give you the idea of the stage, right? And depending on what is found, sometimes it might be radiation. They have some targeted therapies nowadays. I mean, the urologist will discuss all of that with you. But I'm telling you, in the early stages, I mean, it may not involve even surgery. That's what I'm saying. It may just be watching it, and then you will have the opportunity to work on it. You know, much people using herbal preparations, guinea hen weed and the like, to keep things under control. Them green juice, them cut out sugar, them do all kind of stuff. Now, I'm not saying that's a cure. Don't get me wrong. But what I am saying is that these, you get the opportunity to intervene early. Men, happy Father's Day. Do not wait. Are you picking it them? Your wife who going to be the one bawling. Understand? And the more advanced the disease is, that's when you're going to need CAT scan, bone scan, this, that, all kind of medication. And then of course that they're going to deplete all the money. And you know how it go. You know how it go. So be wise. Be wise. So if I had the opportunity, and if I had a moment with my father again, because I know my father must have had symptoms, but like most men, he tough it out. And I know in that regard, my father must have had regrets, because it must have been hard to be in the hospital and see your wife and your children mourning and crying. But here it is. Just go get it checked. Until next time, Dr. Jane.